All attendees are in listen-only mode.
Good afternoon, and thank you for joining us for the third in a series of 5 pre-conference webinars being offered in preparation for the upcoming ASAP National Conference, May 31st through June 2nd in Nashville, Tennessee. Before we begin, I'd like to take a second to go over a couple housekeeping items related to today's webinar. First, you will notice a Zoom Viewer button in the upper left-hand corner of your screen. You can use this button to adjust the size of your webinar screen. Secondly, in the control panel located on the upper right-hand side of your screen, you will see the word Questions listed. Use the plus and minus button to open or close the question box. This is where you will want to type in any questions you have for Debbie and Sarah. The presenters will respond to these at the end of the webinar. In the event we run short on time or can't get to all the questions, please know that Debbie and Sarah are committed to responding to these offline. I will send the questions and responses to all registered attendees. And now, I am pleased to introduce our presenters for today's webinar, Debbie Riley and Sarah Greenblatt from the Center for Adoption Support and Education, otherwise known as C.A.S.E. Debbie is the CEO of C.A.S.E. and has 35 years of professional experience, including extensive healthcare management, administrative expertise, designing and developing programs, direct delivery of specialized counseling services, mental health training, child advocacy, and public policy development. Debbie created a continuum of evidence-informed programs to improve the behavioral outcomes of foster and adopted youth and their families. For over a decade, she has built and implemented a framework for training an adoption-competent mental health workforce nationally and is the founder of the Training for Adoption Competency Curriculum, TAC. Through a recent federal 5-year grant awarded to C.A.S.E. from the Department of HHS and ACSW, Debbie will serve as the PI to establish a National Adoption Competency Mental Health Training Initiative, which will build the adoption competency capacity of child welfare professionals and mental health practitioners that serve youth moving towards permanency and youth living in permanent adoptive or guardianship homes. The NTI will develop state-of-the-art adoption competency web-based curricula for each group for use on a national basis. Debbie is also co-author of the book Beneath the Mask, Understanding Adopted Teens. Sarah Greenblatt currently serves as director of the federally funded National Adoption Competent Mental Health Training Initiative at C.A.S.E. Previously, she worked at the Annie E. Casey Foundation with the Jim Casey Youth Opportunities Initiative, where she co-authored issue briefs on adolescent brain development and the impact of trauma on youth in foster care. She was also the founding director of the Casey Center for Effective Child Welfare Practice, where she focused on building strategies for funding and improving adoption-competent child welfare and mental health programs. Sarah holds master's degrees in social work from Columbia University School of Social Work and early childhood educational administration from Lesley University, as well as a bachelor's degree in child development and family relations from the University of Connecticut. Debbie and Sarah, thank you so much for taking the time to share with us today. Welcome.
Thank you so much. Sarah and I are so pleased to be able to offer this webinar and we'll have over the next hour. So I'm just trying to move our slides for everybody. All right. So I'm having a little challenge here getting the slides to move for you all.
Debbie, can you hit enter or page up or page down?
No, it's not moving. I have to tell the audience, we practiced and we were doing a great job here. Nothing is moving.
Yes, she says nothing is moving.
So bear with us.
Debbie, I'm wondering if you might want to
minimize her control panel.
Minimize your control panel.
Yeah, push that. Yes.
Yes. Click on that. Now can you advance?
I cannot. I'm really sorry.
Okay, troubleshooting again, not sure why this is occurring. I'm wondering if maybe you ought to hit escape and come back into the PowerPoint. Is that possible?
I can try that. That's not even letting me escape. Okay, let's try again. There we go. What brilliant minds. So, again, welcome to everyone. I want to talk a little bit about the initial conceptualization of our work, which began in January 2008 out of a growing need across the country to build the capacity of our clinical workforce in becoming, expanding one's knowledge in adoption competency. So as was shared in the introduction, C.A.S.E. had the wonderful opportunity to develop the TAC curriculum, which is a major product of our overall initiatives to expand the adoption competency of those providers that are interfacing with our most vulnerable children, those moving from foster care and also those youth who are adopted. So we built our work upon a lot of earlier work and something that actually Sarah spearheaded early on through her involvement at C.A.S.E. Family Services, where there was a convening and then a white paper that really listened to the voices of adoptive families who told us in so many ways that they were not having the appropriate services, that they were really tired of being offered things that really wasn't what they needed, and what they felt that they needed were professionals that really understood the nuances of the mental health issues that their children were experiencing and the challenges that they were having to support their children. So within the TAC project, we had some very rigorous goals. One was to develop a national evidence-based adoption competent training standard. So what we really wanted to look at is we were aware that there were, and there still are, other post-certificate programs in adoption competency, but what we became quite aware of was that there wasn't really a standardization, that we couldn't tell if one program had knowledge that was equal to the other, and really when we would think about what would one need to be in order to become adoption competent, we knew that we needed to standardize those competencies. So we did that. We pulled together an expert of individuals across the country that had focused upon providing these kinds of services in both child welfare and in mental health, and help us to develop those standardizations, which I'll talk about a little bit later. From there, we took those core competencies and we developed a curriculum that was manualized, because the other awareness that we had in some of the current programs was that it was dependent upon speakers, and there wasn't a way to, again, track the standardization of the information or the validity of what was being delivered. So we developed a manualized curriculum that we tested and evaluated so that it could be replicable in the future. And we, I'll talk about that a little bit more, and then we have been working on the conceptualization of implementing a national certification in this arena of adoption competency. We've completed a needs assessment, we've hired a consultant that specializes in certification, and we've gotten a lot of feedback from consumers as well as practitioners that this is something that the field would like to see, and maybe that would be some more of your questions later on that we can talk about. So when we speak of those core competencies, we broke them down into 18 domains, and this PowerPoint will be available for you after the presentation, so I'm not going to read all of them. But we really spent a lot of time in thinking about what were those behavioral health and adoption adjustment issues that families were struggling with, and built the curriculum around these core competencies. So ranging from just the history for many of those practitioners that aren't immersed in the field of adoption to really talking about how we support families in the pre-adopt arena, and then looking at the differences in parenting a child by birth and through adoption, and then really delving in a very deep way clinically into the overarching issues that one would see if you were specializing in this kind of practice, and certainly embedding what the field knows now around the impact of trauma and brain neurobiology, as well as then focusing on such varying types of adoptive families, family formation integration, focusing a lot on multicultural and cultural issues, certainly not leaving out, which sometimes we do, the whole focus on birth family members, and then openness and race, ethnicity, and culture, and then spending a lot of time in being able to articulate with those clinicians participating what are the most cutting-edge, evidence-based, or promising practices that seem to be most effective with this population of children. The TAC curriculum, as I said, is face-to-face. It's classroom-based. There are 11 sessions that are about 6 hours each, with one online at-home module. And then the final session is an integration of the knowledge where the students have a project where they need to pick a case that they're working with and apply a particular domain that I've just described in presenting to the other students. The sessions are information sharing. We extend a great deal of resources and handouts and include some of the best practices in adult learning. As you can see from this map, now the TAC is in 13 states, and we've just accepted our 14th state, which is the Georgia Department of Health and Human Resources will be joining as a TAC site. So we're really excited, and for those of you that come to the conference in June, we'll talk more and you'll hear from some of our actual TAC sites. But you can see the variety of sites that we have. Some are community-based, some are child welfare agencies, some are university-based, or public-private partnerships, which I think make this a really unique and enriched project in being able to infuse this across so many different domains. So what I want to do now, and I would like to, we have a poll, and I might need now that I minimized my screen, we have some questions that we would like to ask you, and I'm going to try to get that back for you if I can. So we developed some interesting questions that I'm going to integrate a poll question now that I'm going to send out to everyone. And I will give you a minute to go onto your computer, it's kind of fun, and answer that question. And then in a few moments I'll close it and I will share the responses with everybody. So it'd be just interesting to find out about our audience. Okay, so I'm going to share our findings, and about 89% of you all voted. So those that are attending, you can see that 26% of you are program managers. We've got some, which I'm really excited, some psychologists and social workers, and for my background, a couple marriage and family therapies, and wonderful that we have almost 40% of attendees today are child welfare staff, and then 15% others. So when we get to the questions, maybe we can find out the others. I'm hoping maybe some parents are on, or maybe some educators. So thank you for participating in the poll. That was kind of fun. Okay, so I need to, sorry y'all, I have to minimize my screen again. Oops. You know, it might have to go out of this again. Okay. All right. There we go. So with that in mind, I wanted to share a little bit about with you in regards to the different sites that we have and the number of participants. So we're almost at the TAC, reaching over about 500 now. I know more, about 550 clinicians have participated, and you can see on the slide the different organizations, the representation of those organizations. Just like we just did a poll in regards to who is listening today, those TAC participants come from a wide range of clinical backgrounds. The bulk of those therapists that we've trained are licensed social workers. We're really excited that we also have a large percent of marriage and family therapists and also psychologists, as well as licensed professional counselors. The work settings are also very varied, which seems to be indicative of who's listening today. So ranging from mental health private partnerships to child welfare agencies. Many of the child welfare agencies that we're interfacing with actually have mental health providers in-house. We're excited that we're able to reach now private practitioners that we want to bring into this work. And then, as you can see, many practitioners are also working in specializations within adoption agencies. And nicely to see that 20% are in just general family service, community-based mental health. We issue, as again I said earlier, there is not a certification currently in the country. Most of the programs, including the TAC, offer a certificate of completion, and we have two levels, advanced and basic. And the advanced are for those therapists that also complete the case consultation that is part of our protocol within the TAC program. We have implemented a very rigorous evaluation from the very beginning, as we want to move this protocol into an evidence-based, and we're getting close to being able to do that. And we also wanted to ensure that what we set out to do, we were achieving those outcomes. And so we hired an external evaluator, PolicyWorks, who's been working with us since 2008, and the evaluation is consistent through all 13 sites. We vetted the definition that we'll talk about in our workshop for those of you attending about what it means to be adoption competent, and we sent this survey out across the country, and we also had people respond internationally as well, and we had close to 500 responses, which was wonderful, and had high validation of the definition of what it meant to be an adoption competent therapist by adoptive parents, which is very important to us, that if they were going to seek services from a professional, what would they want that professional to be in regards to the competencies? And they very much were aligned with the definition that we had vetted and developed with our National Advisory Board. Our evaluations to date are something that we can be very proud of. We have a control comparison group of clinicians that have not participated in any kind of adoption competency training. And what we have experienced from our work is that certainly the knowledge that one has coming in is greatly enhanced post-evaluation that you can see on the left side of your screen. And then one of the other areas that was very important to us is that by having this knowledge base, would we see some kind of change in one's clinical practice, no matter what your clinical setting was? And all of our participants, all 515, have showed a clinical practice change in at least 2 domains at 100%, and 5 at 64%, and in all organizational level about 55%. So what that means is we're seeing a change in the assessment tool of being able to, at least at intake, even ask some very broad brush questions around adoption-related issues. We've seen infusion in the inclusion of family work and not seeing children individually, to really integrating more of the trauma-based approach, as well as really enhancing one's skills in the domain of processing loss and grief, and feeling a little bit more comfortable in addressing some of the potent issues around transracial placements. So as I said to you a little bit earlier, we are working to move this into an evidence-based protocol and are very close. We have one next piece of research that we will be implementing this year, where we're going to begin to look at client outcomes of those therapists that have been TAC trained versus non-trained clinicians. And we will begin that, that research project this fall with some funding that we've received and funding that C.A.S.E is going to put into that. So once that's completed, we'll be applying to the California Evidence-Based Clearinghouse to move this to an evidence-based practice. So I am going to now also go back to the computer so that we can do another poll. So if you bear with me, we'll get that back up again. I'm working on it, audience. Okay, so here we go. We're going to start another question. Okay, all right, so here's the next question I'm going to launch. And this question is, as you can see, about if you've ever received any postmaster's training in adoption competency. And we're almost going to close the poll, and I will share those findings. Okay, so I'm going to share now the findings, and which is really interesting for us to share that about 76% of you said no, which is fine because there's lots of opportunities to get this training, and 24% said yes. So thank you very much for sharing that with us. Okay, I'm going to go back to okay, great. So where we are now that we're really excited about is based upon the work that we've been doing, we've been strong advocates of how to move this even further into the field. And as shared in the introduction, in October, C.A.S.E was awarded a 5-year federally funded project to expand the adoption competency through a web-based platform. And this was through an incredible commitment that we're really excited about by the Children's Bureau to address this unmet need. And so I'm going to turn it over in a moment to Sarah Greenblatt, who is the director now of that initiative, and C.A.S.E is honored to have Sarah join our team with her extensive experience. And our target training population will broaden from what I just shared about TAC to include a web-based protocol for child welfare practitioners as well as for mental health professionals serving children and families. So I'm going to turn it over to Sarah, and I'll throw in another poll as Sarah moves through the discussion. So Sarah, welcome, and I'm turning it over to you now.
Great, Debbie, thank you so much. Debbie's going to still continue to work on the PowerPoint as I'm presenting, and I will talk with you with much enthusiasm and excitement about the newest project that C.A.S.E is involved in. It is the National Adoption Competency Mental Health Training Initiative, and it is a complex project in that we are taking knowledge that we have about adoption competency and about what we know from adoptive parents and children and youth that have been adopted and are living in guardianship families, and about the struggles that they've had in coming together as a family and staying together as family, recognizing the relationships that their children have often had with other families that were their birth families, and the challenges that poses for the group. So, Debbie, are you having difficulty moving the slide along? Here we go. Thank you. So, as Debbie mentioned, this federal project is really established so as to meet an unmet need, is to make this kind of training and adoption competency in meeting the mental health needs of children available to all states and tribes and territories in a consistent way. And so the purpose of the grant is to certainly to establish that web-based training initiative, and using the web-based format, making it available to the child welfare professionals and mental health practitioners that work with children and families that are experiencing adoption or guardianship. It is to increase the numbers of the workforce, both the child welfare and the mental health workforce, that have access to this quality standardized training. And if they have the training, our hypothesis is that the therapists and the social workers would be better able to help parents improve the well-being outcomes for children and families, as well as support appropriate therapeutic interventions that support the stability of these families. And we want to base the knowledge that we have in this curriculum, and the content will be based on the learnings from previous adoption competency training models, and it will complement existing initiatives that in states and tribes and territories that focus on strengthening the capacity of their child welfare workforce as well as the mental health workforce, and in particular with this targeted population of children and families who are either moving towards or having had achieved permanence through adoption. Our next slide talks a little bit about the target population and the need. As we said, it's children moving towards permanence through adoption or guardianship and their families. It's children that are already living with adoptive and guardianship families and improving the access that they will have in the community to therapists that understand what they've been experiencing. And these are children who have experienced multiple traumas before and after entering foster care. And we will be addressing trauma, and we like to think of the children as trauma survivors. They have experienced, many of them, abuse and neglect before entering care, certainly separation from family and loss upon entering care. Too often, and sadly, they've experienced multiple moves and relationship disruptions while they're in care, and the ambiguous loss and the unresolved grief that comes from these kinds of experiences. Many of the children have had a limited opportunity to know their story in a safe way and to begin to resolve their grief and loss and begin the healing process. And we know, too, that too many of their families may not also know their child's trauma history, and so it's the knowledge of the trauma, it's the understanding of the children's story that will help make this training more successful with the social workers and mental health providers that will be taking it. Our next slide is talking about can you move it on? Great. Some of the challenges that we see in the behaviors of children that have had the experiences that we just talked about. And we see a lot of internalized and externalized behaviors such as depression or withdrawal or acting out in anger. Many children and young people that mistrust adults because of the experiences that they've had. They also are experiencing developmental delays, poor academic performance, very often confused sense of belonging, and often have a limited understanding of their past, which brings deep anxiety in their present and fearfulness about what's going to happen to them in the future. So being able to provide the adoption competency and guardianship competency mental health training can help these children and families coming together to better understand these issues and work on them together in a process that can promote healing and stability in their families. So let's talk a little bit about the Adoption Competency Mental Health Training Initiative itself. It is designed, as we said, to meet the unmet needs of children experiencing foster care and adoption, and we're doing this with 4 objectives. One is to create a state-of-the-art, evidence-informed, adoption-competent mental health web-based curricula for child welfare professionals and mental health practitioners, and one that would be accessible and available and able to be implemented within all states, across tribes, and within the territories. We will be delivering this state-of-the-art training, and we will be implementing with the training a national certificate process that will address the competency that trainees have learned and the completion of the training. I will talk a little bit about what the training looks like in a minute, but there is a capacity for us to be able to document as trainees are taking this training which modules they've completed, and then when they're finished they will have a certificate that indicates their completion and the competencies that they have as they have completed this work. And we are really fortunate that the project will be evaluated rigorously in its pilot phase, and it will be the curriculum will have we will have an opportunity to revise the curriculum based on what we learned through the pilots, and then make revisions before we go forward with a national launch, making this available to all states, tribes, and territories through their training departments and in partnership with their mental health, child welfare, and mental health departments. The next slide gives you a sense of what this web-based curricula looks like. This is a very different and new way of training, and I think this I want to describe this a little bit, and then maybe we'll do a poll question about web-based training. But the concept of the Children's Bureau, who is our funder, and we do have a collaborative agreement with them, cooperative agreement with them, is that we would build essentially 2 separate curriculum. One would be for child welfare workers and their supervisors, and the other would be for mental health practitioners and coaches that would work with them. So for child welfare staff, clinical or casework and case management, child welfare in public agencies and private agency partners, we will have 8 modules, and each module will have 5 lessons, and each lesson will be about a half an hour long for a total of 20 hours. And we've designed this with our partners at the University of Maryland School of Social Work and their online training center, with the knowledge of what adult learning styles and principles of adult learning have taught us about the time at which, the length of time that people feel comfortable staying online learning. And usually it's about a half an hour, and so we combined the modules to include 5 lessons, and each of those lessons will be half an hour. And these modules will be taken sequentially, and so that staff that will be taking them will take them one at a time and can move forward in at their own pace with it. Child welfare supervisors will have the 8 modules that are built for the workers, but they will have 2 additional modules that will speak to the supervisory skill and knowledge that's needed in order to move adoption and guardianship competent mental health services forward with families that are moving towards adoption and guardianship. The mental health practitioners training will include 10 modules, again with the 5 lessons and half an hour per session for 25 hours of learning. And we will also be preparing a network of coaches who have participated in the training, both this and others, that will be able to offer 4 of 6 to 8 modules that will be 90 minutes in duration of topical coaching sessions, looking at the competencies that were taught, how they've been applied to the practice that the mental health providers have engaged in, and providing feedback, more like case consultations related to the competencies that have been taught in the curriculum. And this will be a national effort to offer to the mental health providers that do take these modules in a web-based format. Let's see what the next slide is, and if we want to stop there to do a poll. Let's just describe a little bit about online training, and then we'll do a poll. I think the unique part of this that the Children's Bureau had in mind and that we thought was exciting was that with web-based training, this can be accessible to anyone with a computer and internet access, and that while younger users are more inclined to take this and are familiar with web-based, this is really available now to all workers, whether they're in whatever their backgrounds are, in a way that can increase the knowledge and the skills and the values around meeting the mental health needs of children who are moving towards adoption and guardianship, and broadening the numbers of staff that are going to be available to work with children in a sensitized and understanding way of the experiences that they're having as they're coming together through adoption and guardianship. What's exciting about web-based is that it broadens the field of who has this knowledge, but the training will be standardized, and people in different states, while they'll receive the same training, it may be applied and implemented in a different way based on the expertise or the readiness that states have for web-based training, and the capacity for them to support workers as they're learning at their own pace. It's also easier and admittedly less expensive to use web-based training in the long run. Material can be updated, and staff can have the benefit of what the latest information is. So why don't we start now, Debbie, with the poll on this? And as you'll see, your question is, how would you best describe your comfort level in web-based training? And you have 5 options here. Okay. I'm having trouble seeing the percentages on my format, but it looks like 30.
So I can share.
Okay, good. That'd be great.
38%. Okay, so 36% of you see yourselves as highly advanced, which is great.
Good.
38% intermediate, and about 18% are novice. And I think between 5% might have some fundamental awareness, and we have a few experts on the phone who probably are thinking, wow, Debbie and Sarah could use some help in this web-based training.
Right.
But actually, so that's really interesting. I'm going to hide this now and turn it back over to Sarah.
Great. Thank you, Deb. So I think that this is going to be an exciting opportunity for us to learn more about the interest in and the readiness for and the expertise in using web-based training, and how this will apply to teaching the clinical knowledge and skills and values that are needed in order to improve the services that families coming together through adoption and guardianship have. Web-based training has been grounded in research, and the effectiveness of it appears to be quite broad across different content and learner types. And this is interesting that in some of the research that's been done, there really is no significant difference in the learning outcomes in face-to-face instruction compared to online learning, even in courses that are clinical in content like this one. I think this last bullet is really critically important, that online learning can be enhanced by prompting learner reflection. This is feedback that we've heard from most of the states that we've talked to, representatives of states and tribes even that I've talked to, is that it's as the web-based training is implemented, we need to think about how we can support the learner's education through the opportunities for reflection about what they're learning. And so that will pose some interesting opportunities for us to think about what the best way is to support the individualized learning that takes place through web-based training, with the benefits of being able to reflect on this with supervisors and reflect on this in groups with other workers. So I look forward to getting feedback from folks as we move forward with this on what's worked in your community and what we should know as we anticipate moving forward with this. Okay, the next slide. This talks about the format for the online training, and you can read this basically, but we will be, for each module, there will be a pre and post test set of questions, and as I said earlier, each learner will be taking the training in sequential order. So in order to move from one module to another, the post-tests need to be passed. So, and I think there's a number of 3 or 4 times that a learner can take a post-test, and then they have to go back and take the module over if they aren't able to pass it. But usually they do it. They do pretty well from what we understand. There will be quizzes embedded. We will have printable notes. There's closed captioning capabilities and synced audio recording. And we can move forward with the next slide. There is opportunity for a discussion board. There will be role plays, clinical demonstrations, videos, and case scenarios. So we have a network of partners right now that are working on this. I think that's what we're moving to in the next slide. That are well, this is a little bit more about what the type of web-based, but I think what I'd like to do is jump to our core partners so that I can give you that information, and then we can open it up pretty quickly for questions. But C.A.S.E is working with the University of Maryland School of Social Work, as I said, their Institute for Innovation and Implementation and their online training center there, to build the web-based training material, and they will be also providing technical assistance, and there is an evaluation team at the School of Social Work that will be working with us on the rigorous evaluation, looking at the learner's experience and the accessibility and usability of the web-based piece and the satisfaction with web-based learning, as well as looking at a systems level piece in terms of training implementation that's web-based and the impact that that may have on practice, and looking at overall costs of building a web-based training curriculum. Policy Works, that has been involved in the TAC and evaluation work with C.A.S.E in the past, will be working with us to engage in jurisdictional scans of all the states and tribes, just as how are they organized, and we'll have profiles of each state and tribe that we can gather and develop about how training is organized and what how training and practice change is embedded in their systems change efforts. They will be looking with us as well at other adoption competency training programs and lessons that they've learned and can help us by giving us feedback as we develop our curriculum. And we will also have a QA system and project management system that PolicyWorks will be helping us with. The most important people that are the members of our teams, along with the 3 that I've talked about now, are our curriculum content consultants, and they will be working on establishing competencies, definitions of adoption and guardianship competent child welfare and mental health providers. They will be developing the modules, the lessons, and the learning objectives, and that's Susan Smith and Carol Bishop, both of whom have had extensive experience with adoption and guardianship practice and research, and we're excited that they will be pulling together the knowledge and the values and the skills that compose the competencies for this curriculum. We have a number of national network partners. We are working with the National Association of State Adoption Programs, the National Association of State Mental Health Program Managers, New England Association of the Child Welfare Directors and Commissioners, Public Human Services Association, and NAPQA, as well as the National Staff Development and Training Association, and certainly other national partners that will help us work with their state members over time as that evolves. And in addition, we have a number of subject matter experts that are listed here, and you'll be able to have access, as Debbie said, to the PowerPoint, so you'll be able to work with them, and that's the next slide. Well, I guess it's not in that slide. The phases of this is, in the first 2 years, we will be building the curricula, both developing it in the content area and then converting it to web-based format. And at the same time, we'll be working with the states and tribes to develop and identify the 5 to 7 pilot states or tribes and territories that we want to work with, and to build the coaching components. Now, over the period of 5 years, the first 3.5 to 4 years, we should have the pilot completed, and into the 4th year we'll be making revisions, and then we should be able to move to a national launch with this curriculum available to all states, tribes, and territories, with the lessons learned from the pilots for recommendations for different types of states or tribes and territories, and how they're organized and how it might work best in their systems to implement this training, so that more child welfare and mental health professionals would have access to this quality training. We hope that we will be able to work with the sites across the country to implement and sustain the strategy that will involve them in the beginning and the planning, help them infuse this in their training systems, help to be able to figure out how to best use web-based training, and to promote the training not only with the public agencies but private agencies that they may contract with. And then we are hoping that as workers and mental health providers are trained and have been certified in this specialized area of practice, that particularly in the mental health arena, that there may be therapists who have this training that would have preferred status in receiving referrals from the public and private child welfare agencies. So our last polling question for this section, I think we can put that one up now, if that's possible. And would you like more information about taking in-person or web-based adoption competency training? %73 would like more about web-based training, and 27% in-person. That's great. At the end of our PowerPoint, you have information about how to reach Debbie or me, and we certainly can talk with you more about that if this is something that what we're doing is something you're more interested in. We will be, in our evaluation, looking at short-term, interim, and long-term outcomes. As I said earlier, at the systems level, at the trainee level, and we are hoping to also look at the family and child level in terms of their experience in working with therapists that have had this training in adoption competent mental health practice. So Debbie, I think I might want to turn this over to you, and we could figure out how we can take questions.
Okay, so Sarah and I are both on, and I think someone's going to help us with the question part, our technical team.
Yes, this is Nicole.
Hi, Nicole.
Hi, guys. We surprisingly do not have any questions from our attendees today. I think they may have just been blown away by all of the information that was presented and are maybe digesting that. But I would say to any of the attendees that are on with us, if you do have a quick question that you'd like to type in, please do so in your control panel on the right side of your screen, and we'll be able to see those very quickly, and we can ask Debbie and Sarah for the responses to those. Additionally, and while we're waiting to see if anybody does want to submit a question, I would, remind folks that Debbie and Sarah are, I think as Debbie relayed earlier in the presentation, they are more than happy to share the PowerPoint from today. And if you will please just send me a quick email at nicole@harmonyfamilycenter.org. And all you have to say is, I'd like the PowerPoint from today's presentation, and I will get that out to you this afternoon. Also, we will send a link to all the attendees with the recording of today's webinar, as well as the first two that we also did. So you can access those, share them with others that might want that information. It does look like we have a few questions, so give me a moment and we'll get to those. Okay, the first one I do believe that we have responded to, about how will the PowerPoint presentation be shared after this webinar. Go ahead and just, as I said, send me a quick email, nicole@harmonyfamilycenter.org, and I will forward that presentation to you. Next question. What would be the cost for a private practitioner, both web-based and in person? And that may be, Debbie and Sarah, up to you, but that may be a question. I can provide you the email address of the person that submitted that question if you'd prefer to answer it offline. I'm not sure. You tell me.
I mean, it doesn't matter. I think we have some answers and some we don't. I think for the non-web-based, as I said, there are programs such as TAC and others that some have fees, some of our TAC sites have grant funding where there is no cost for the attendee. So if you're interested in that, this person could email me, or I could get your email. For the web-based, you know, it will be free eventually. I mean, that's I think the intent of the Children's Bureau. Again, that, you know, we're looking at 5 years out that you know, will be available as a national launch, and we'll be sitting on a platform within the Children's Bureau. And Sarah, I don't know if you want to add more to that, but that's what we anticipate at this point in time.
Yeah, that was the goal of the Children's Bureau, was to make this available and accessible to as many people as possible throughout the country. There will be no cost to it to the user. It is not as extensive, and I think that's important, as some of the in-person adoption competency training programs that exist around the country. It is a really good foundational platform for what do you need to know and what can you do. in your role as a child welfare professional and a mental health professional to improve your practice with families coming together through adoption and guardianship. And it opens the door for even more intensive trainings that are offered across the country, TAC included.
Right. So I think we see the continuum of this kind of training, and are excited that so many of you are on today and obviously have some interest. And so we will keep you posted to give you more information along the way, and would love to hear more from you. And you could probably work with Nicole and Cindy about how to reach Sarah and I, and I think our email or website is up here, so you can reach out to us too.
And to recap, I think you did answer this, especially Sarah, I think you talked about the phases, but a couple of our questions are similar in that folks are just wanting clarification when the web-based information and the curriculum will be made available. So did I understand you said that that'll be 5 years out?
Yeah, yeah.
Okay.
So the final product, the national launch, will be within the 5th year. As Sarah was speaking a bit about, we're now going to be identifying 5 to 8 pilot sites across the country. So obviously some practitioners and child welfare staff will have accessibility to it through being part of a pilot, but it won't be for national consumption until the 5th year.
Okay. And I did want to share a quick, one of our attendees, I just thought I would take a moment to share a quick note that I'm sure you both will appreciate. She said, "Thank you so much for this information and these efforts to achieve adoption competent professionals. We're looking forward to more information on the subject matter." And I think that probably is a shared sentiment across all of our attendees as well as nationwide. We also have one last question I think we have time for. We have someone asking if there's a way to participate in the pilot study.
I'm going to let Sarah speak to that.
There is a way to participate in the pilot study if your site, whether it's your state or your county or your tribe, has been selected. We're in the process of doing that. If you are interested in that, finding out more about it, and I'd love to know where you're from, and we can let you know what process we're in what the timing is in the process of selection. But it's a mix of we're looking for sites that represent the diversity and the way child welfare services are organized across the country. So state administered, county administered, urban, rural, agencies that have a capacity for web-based that's pretty advanced, agencies that might want to strengthen their web-based, where they may have partnerships with mental health providers, states where there may be partnerships with tribes already. So we're really looking at the diverse array of the diverse way that services are organized across the country and systems are organized, so that when we select a pilot site to work with us, we have a representative of other states and jurisdictions in the way that they're organized, so that we, in doing the evaluation with the pilot, can work on these, enhance the strengths and work on the kinks, and when it goes live nationally, it will hopefully be able to be applied to any state agency or private agency or tribe that has the interest in and the capacity for web-based training. I think that's the best way to describe it, but if you've got interest in a pilot, please let us know.
Debbie and Sarah, what year are you in of the plan?
We didn't say that. This is the 5th month of the project.
That's what I thought. Okay, so we had somebody ask where we're at, and I thought, well, I think it's still in the very the
it is
front
the very
end.
Beginning.
So
yeah, it's the very beginning, but it isn't too early to let people know that this is coming down the pike, and there may be a way for them to participate in it.
Absolutely. And on that note, are you both okay with me just going ahead and sharing your email addresses with folks? Because we have had a couple folks who have said that they're interested in communicating with you about being considered for the pilot. as part of the pilot? Or just, okay.
Yes.
Debbie's...
I thought they were on the end of the PowerPoint. They're not. So maybe we could put it on there too when we send it out.
Oh, yeah, I will do that. So, folks, if you grab a pen, and Debbie's email address is Riley, R-I-L-E-Y, at adoptionsupport.org. And Sarah's email address is Greenblatt, that's Greenblatt, at adoptionsupport.org. I would also remind folks, it does look like, and Debbie and Sarah, another attendee, just wanted to let you know that they think you have done an awful lot in 5 months, and I would have to agree with that.
Thank you so much. I feel the same way.
We need that affirmation.
Yeah, we do.
Exactly.
We do.
Well, I appreciate you both so much. It looks like, one, that's all the questions that we have, as well as it looks like we are running close to maybe about a minute left. I would remind our attendees today, if you have registered for the ASAP conference, you have opportunity to learn even more and hear from not only Debbie and Sarah, but Ann Atkinson from PolicyWorks, Edie Swidler from Lilliput. I don't think I'm forgetting anybody, am I, Debbie?
No, I think I mean, there may be others that are coming too, but
Right.
those are the formal presenters there, yes.
And so that workshop will be on Monday afternoon, June 1st from 1:45 to 5 p.m. So you'll have, 3 hours of presentation time and time spent with Debbie and Sarah. So please take advantage of that. If you haven't registered for the conference yet, we would really encourage you to do so. I think that we've got some fabulous folks coming from all across the country to focus in on post-adopt services, and we'd love to have you join us. Lastly, just a reminder that 3 weeks from today we'll have our next pre-conference webinar, and Kim Stevens from NACAC and Nicole Dobbins from Voice for Adoption will be presenting on the new law and the Strengthening Families Act, so you want to make sure to join us for that. As well, on May 20th, Daphne Lender with Their Play is going to be doing a workshop on timeouts and talking about attachments. And that will actually wrap up the 5 pre-conference webinars that we've got scheduled. Well, without further ado, Debbie and Sarah, thank you again so much. And I hope everybody's enjoyed the past hour. I know we have, and certainly a lot of great information.
Thank you so much for inviting us.
Thank you. Yes, thank you. And just think, by June we'll have even more to tell about what we've been doing.
Absolutely. Well, listen, I hope everybody has a great day, and we hope to have you back with us on May 13th. Take care.